member for London West.
Thank you very much, Speaker. My question is to the Premier. Speaker, more than 65,000 people in the London area do not have a family doctor, including almost 1/4 of the patients who go to St. Joseph's Hospital urgent care, a significant increase since just last year. Rukaya lives in London West, and she has been listed with Healthcare Connect for almost 2 years. She was diagnosed with cancer after an ER visit last year and was treated with surgery. Without a family doctor, she has no choice but to keep going to the ER for all monitoring and follow-up care. Speaker, whatever this government is doing is not working. How much longer do Londoners have to wait before they will be able to find a family doctor?
Minister of Health.
Thank you very much, Speaker. I hope the member opposite has received a copy of the Your Health document that has been circulated to all MPPs, because it actually highlights in that document exactly the expansion that we have in the works to expand the number of family health practitioners and primary care practitioners practicing in the province of Ontario. In fact, since our government formed government, we have had over 1,800 new family docs practice in the province of Ontario. Of course, we also have two new medical schools that are being built. And in fact, in Brampton alone, we are going to have new family docs who are registered and practicing their study, starting to practice their study in September of 2024, because we were able to work with a partnership with the City of Brampton to find an existing building, renovate it, and get those students in training as quickly as possible. I'm proud of the work that we're doing.
Supplementary, once again, member for London West.
Thank you, Speaker. Again to the Premier. Katerina Alexander Wills also lives in London West. She's been looking for a family doctor for 4 years, so long that her Healthcare Connect listing expired and had to be resubmitted. She hasn't had a physical in almost 10 years, despite her family history of medical concerns. Mo Alajidi is a nurse and has been looking for a doctor for her family since she moved to London in September 2021. Another constituent emailed me on Friday. She's pregnant and needs regular care. Speaker, does this Premier understand that forcing people to go to urgent care or the ER after a serious problem develops is not only costly to the system, but bad for patient health?
Minister of Health.
Thank you, Speaker. The member opposite is highlighting exactly why we as a government have made these investments since 2018. And in fact, if you would review the Your Health document, I hope you share it with those constituents, you will see that our expansion for primary care model has already happened. And in fact, in the city of Kawartha Lake, Haldimand, Kawartha Lakes, Brock, as well as Minister Todd Smith's riding, we have expanded primary care and nurse-led practitioner clinics, because we understand that they are a model that is working very effectively and ensuring that the people of Ontario have access to a primary care physician when they need it. We are continuing to do that work. We are continuing with those expansions of primary care, nurse-led practitioner clinics, and working with our partners to make sure that we have